Ms. Josephine Sirna, has for over 50 years, has been a transfusion-dependent thalassemic, and she has used her lived experience as a patient to raise awareness, educate, and advocate on behalf of patients with thalassemia and other inherited blood disorders. She's a longtime volunteer in the thalassemia community, and she led the successful efforts to include thalassemia patients in Canada's hepatitis C compensation plan. She was an inaugural member of Canadian Blood Services Community Liaison Committee, and Josephine continues her volunteer work as the current president of the Thalassemia Foundation of Canada, and she's also on the board of the Network of Rare Blood Disorders in Canada, while working full-time for the federal government. Josephine obtained a BSc in biochemistry from McMaster University and her MSc in laboratory medicine and pathobiology from University of Toronto. Without taking much more time, I will pass on to Ms. Josephine Sirna, who is our moderator for today. Thank you.
Thank you, Ms. Lanry. Hello, everyone. Welcome to the World Inherited Blood Disorders Day webinar. We have a housekeeping slide. There is a chat function. Please enter any comments into the chat, and a gentle reminder to stay on mute so that way we could hear the speakers when it's their turn to present. So I'd like now to introduce the speakers. First, we have Mr. Riyad Elbard, a board member of GANSID, who has been a dedicated advocate in the thalassemia and rare disease communities for over 25 years. He is past president of the Thalassemia Foundation of Canada, where I loved working with him, serving the thalassemia community through various lead roles. He played a pivotal role steering the organization's mission to support and fund thalassemia research, treatment, patient services, public awareness, and education. And I know he is located in Toronto, Ontario, Canada. Now, he hasn't joined yet, but I will introduce Senator Sunday Katung. The senator is a Nigerian legislator, lawyer, and advocate for equitable governance, he is currently serving as the senator representing Kaduna South Senatorial District, a former member of the House of Representatives and past commissioner for finance in Kaduna State. Senator Katung brings decades of public service experience and a deep commitment to advancing social justice, health, and education in Nigeria. And we save the best for last. I'd like to introduce Professor Adekunle Adekile, who is a distinguished pediatric hematologist and global leader in sickle cell disease research and care. A graduate of the University of Ibadan with advanced training at Howard University Hospital and the Medical College of Georgia. He has devoted his career to advancing and understanding of the clinical, hematological, and molecular aspects of sickle cell disease, particularly among patients with high fetal hemoglobin phenotypes. Welcome to our panelists and welcome to our participants. I'm going to turn the mic to Riyad Elbard. I will once again invite you to enter your comments in the chat. Please hold your questions to the end of all the presentations. Please put them in there as a reminder of maybe what you want to ask. Again, a gentle reminder to stay on mute. I now will turn the mic to Riyad.
So good morning, everyone. I'm trying to keep this in a layman terms so we can have a good understanding, and I'm trying to address the advocacy within hospitals in a non-specific way so that we can apply that for any setting, whether it's in a developed world, whether it's in a high income or high resource countries, or in the low and middle income countries. So before we start, I think it's important to recognize that there are numerous health charities, whether it's for the disease we have or for other diseases who have more commonalities, And only small percentage are likely managed by well-qualified executive directors, leading a properly trained staff and knowledgeable volunteers. In most cases, the advocacy groups are managed from kitchen tables and leaders, staff who learn by word of mouth or from their mistakes. Usually, we learn a lot from one group or another group that have common issues. And there is no school or program available to teach them how to raise funds, recruit and retain volunteers, write grant if, fund research or talk to government agencies. And I believe that GANSID has the belief that there is a significant need to provide patient advocacy, and a comprehensive program will properly qualify them to face these possible challenges they may encounter when starting, maintaining, or advancing their organization. The goals for advocacy is that the priority goals and most common include is to be a more effective leader, to be a more effective advocate, and to do advocacy change. It's important to fully understand the role of patient and patient organizations in advocacy, the important role that patient advocacy provides to society. So it's important to understand all these. Now, just to talk briefly about a hospital system. Hospital system is a comprehensive framework that manages various departments within a hospital, ensuring efficient operations and patient care. So they are really the ones that coordinate the care and help us to improve patient outcomes. And the importance of hospital systems is that these are crucial for ensuring the healthcare facilities operate smoothly and effectively. They help in coordinating care across various departments, manage resources effectively to improve the overall quality patient care. As healthcare systems evolve, hospitals, sometimes we see them, are joining larger organizations to continue to be competitive, which further emphasize the importance of integrated hospital system. So that's why sometimes you need them to work together as in one setting. So possible needs for advocacy, and it is extremely important to identify the needs, and very often patient support organizations or individual patients are advocating for more than one need. So very often we have one or more needs, and quite often there's more than one that we are trying to advocate for at the same time. This is just examples of that. So safe and adequate blood supply, medical experts, nursing and other staff resources, access to diagnostic tests and or technologies such as MRI or whatever tests there are there to help diagnose that are not invasive, hopefully, and access to medical supplies, new drugs, and advanced therapies. A research program, multidisciplinary care programs for both children and adult patients, and that's the thing that's been most common for many of our disease organizations. And transition programs from pediatric to adult care, that's also another common one that we see a lot of organizations trying to advocate for. So the first step is to identify the following. You need to know who are the key decision makers. You also need to know who are the policymakers or influencers of the policy. You also need to see who are the funders, payers. Usually it's governments in most countries, but some countries you have NGOs or other charities that are, doing philanthropic cause, and they are funding these hospitals or treatment centers, if you want to call them that. Medical experts and other professionals that support your goal. You need to know who is in support of your goal, who has the expertise and professional opinion, and who can help you move your advocacy forward, or they might want to consult with them on how to resolve the issues. Also, you need to know who are all your stakeholders, get them engaged, get them to talk about it and raise awareness of the issues. And community support. You need your community to be there for you, for writing petitions, for raising, questions to your representatives, legislative representatives, and to make a little bit of noise sometimes. So also you have social media and social media tools available. Try to see what tools you have in that area, because that could come in handy. Now, I'm a strong believer in this, to form collaborative networks, and I've experienced this work and really help enhance and advance the advocacy effort, is form your collaboration with healthcare teams at hospitals and centers of excellence, if you have those centers of excellence where you are. Also with industry partners at various levels. There are your representatives from pharma who are either at the regional level or at the country level, or even on the global level, and hospital administration and hematology division lead. Try to have someone who can help you and listen to you at the administration and even within the hematology division at the hospital. Other patient groups, that's again what I believe has always worked. Have other patient groups join you in raising the issues or in advocacy. And as often, thalassemia and sickle cell go together. That's become more or less a natural pathway. Hemoglobinopathy, we have to think in terms of that, or inherited blood disorders if you have more than hemoglobinopathies. And rare diseases sometimes, because these diseases are rare in many countries. Political support, try to build a relationship with elected official, and having that relationship is the same as having a relationship with anybody. Build them in times that you don't need them, so that when you need them, they are there for you. And media reporters, I'm a little bit careful with media reporters, because sometimes they twist things not in your favor. And health critics, you need health critics, because they're the ones who can raise the issues in a different voice and at a different angle, and other health advocates who may join to support your cause. Now, sample to-do list for advocacy within a hospital. Have informal discussions with healthcare team and medical experts. You need them to be engaged on what are the issues you're fighting for. What is it that you need? Host patient meetings, do virtual meetings, town hall meetings, to listen to them and to have their voices heard, and to summarize what are the needs and identify the gaps in patient cares, and if it's in other needs, whatever it may be. Do surveys, for example. It's important to have a credible concern, and to raise the credible issues that the hospital will not, cannot deny, because there are patients who are very concerned or has a need for that. Meet with the hospital administration to request resources. Determine, you have to have these meetings, and you might have to do these meetings quite often. They are the ones who are gonna try and resolve the issue for you. They're the ones who make the decisions. It's not the doctors. The doctors just work in the hospital. Determine funders and key decision makers. Again, who funds this? Is it the Ministry of Health? Is it the hospital itself? Is it somebody outside of that? Is it your local government, or is it your federal government? These are important things to know, because you need to know what you are up against, what challenges you are facing. Write a formal request highlighting the gaps based on the expert opinions, from discussing with the doctors and the patients. And these requests should be in adherence to treatment guidelines or standards of care. Show that they're not meeting best practices, or they are failing to meet the treatment guidelines or the standards of care that you have in your country. Find a political friend or champion of the cause to advance your advocacy efforts at legislative assembly, or with the Ministry of Health, or whatever health authority you may have in your country. Now, This is what I think an advocacy action plan should be, and I would suggest following it step by step. First, you have to propose and ask. 1, 2 items maximum. Don't have a long list of wishes and wants. Just stick to 1 or 2 needs to present and present a solution for the situation. You really want to be part of the solution. You don't want just to highlight the problem. Sometimes they already know the problems, or they might know it better than you do, but you have to try and provide a solution for the situation and make it something that is worthwhile for you and for them to work on. It's not just a simple complaint, because sometimes I see patients have complaints and then they take that as, oh, a major issue. No, that's not going to help. And if they go and complain, that's not advocacy. That's a complaint that could be addressed in a different manner. Formal request, right to formal request of ask needs from hospital administration and hematology division heads. So you have to take your proposal to the hospital administration and the hematology division. They're the first step. They're the first ones who will see that request and follow up with meetings, because they will direct you where your next meeting should be, whether you should go outside the hospital or they try to resolve it within the hospital. And very often their suggestions are very helpful. Sometimes you might have those who will not help you much, and you just go back to them, or you try to appeal it to the hospital CEO and to other key decision makers. So try to work around them. If you are facing a challenge, you're facing a barrier that is not helping you, you just work around it. And forward your request to the Ministry of Health or health authorities to allocate funding for your ask. That's if the hospital is not able to give you a decision, or if the decision is to request more funding from the Ministry of Health. Do that and follow up with their staff. Don't just send a letter and sit on it. You have to send a letter, follow up with phone calls, request meetings, go to meetings, meet with the minister or meet with his staff or anybody that can help you or who is willing to work with you. Follow up with clinic and medical teams to ensure the implementation of ask and provide patient input where possible. If the ministry decided to help you, or whoever is funding this decided to help you, or the hospital administration, follow up with the clinic and the medical team to ensure the implementation of what you ask for is done, and it's done right. And make sure you have patient input, because you do want to be engaged at all levels possible. And if denied, work on media and social media campaign, and maybe patient and family petitions, and repeat the steps above. You start again. The change is not going to happen right away. Now, during your meetings, 2 representatives, preferably 1 patient or a family member, prepare handout, intro of your organization, brief background
We
of
have 1 minute.
situation or crisis, and the proposed solution. Prepare and practice talking points. That's very important, because you need to be ready and know what you're going to say. Usually you have 15, 20 minutes. Use your time wisely, quick intro and greetings. Stay on track. Don't go into talking about sports or golfing or whatever it may be. Be precise with your ask. Don't allow diverting the discussion into other matters of low priority. That sometimes politicians do that very good. Even the hospital administration might do that. They'll give you a little thing and try to make it as it's a big thing, and the discussion will be all around that. No, you don't want that. Make notes of the responses and their reactions. Let them know that you will follow up with their office. Don't leave as, okay, we talked to you, bye-bye. No, we talked to you, we raised the issues, we will be back, we will follow up. We're not going to go away until it's resolved. Successful case scenario. I'm going to go quickly to take away
Okay,
notes.
thank you.
Identify the issues and present a solution. Again, be part of a solution, not the problem. Gather information and patient's feedback and input to have credibility. Develop working partnership with healthcare teams, medical experts, and hospital administration when possible, form collaborative networks, which may include hospital administration and political contacts, participate on working groups and committees to provide viable patient input. The flow of information and communication is very important. Be on alert for any changes and developments. Be patient and persistent. That's very important because change does not happen overnight. Thank you.
Wonderful. Thank you so much, Riyad. We have the dubious, I guess, benefit of and not benefit of, unfortunately, Senator Katung was not able to join us, and that actually afforded us a little bit more time for both presenters. Thank you very much, Riyad. Words of advice came from lessons learned and days lived. Thank you so much for that. I will now, since we don't have the senator, I will now turn to Professor Adekile to present.
Thank you so much for inviting me and for the introduction. And I say good morning, good afternoon, good evening to everybody on the call. Riyad has made my job a little easier because he's covered quite a bit of what I'm going to be talking about. But I'm going to be talking about advancing advocacy with policy makers. And I'll go briefly over some introductory slides and why advocacy is important, especially in the concept of inherited blood disorders, who are the important stakeholders in the role of government and policymakers. And we'll use sickle cell disease as an example, and we'll talk about some practical experiences. The whole concept of advocacy is to raise public and political awareness. Then how do we achieve that? It's through, to start with, education drives and other awareness efforts into society. And of course, you then want to see some policy and system change, look for funding and resource allocation, and build partnerships. Okay. Now, the overall aim is to improve access to standard of care treatments and interventions in an equitable way, and that's quite important. Everybody who lives with a particular disease should have equal access to treatment and standard of care. Okay, so that we improve health outcomes for the patients overall. And why are inherited blood disorders peculiar in terms of the need for advocacy? These are usually very complex diseases. They are inherited lifelong, and many of them, or most of them actually, are genetic. And you see, so to understand the basis of the disease itself is not easy. So that's why you need well-trained professionals who kick off the whole process. So, and quite often the diagnosis, both in the clinics and in the laboratory, are not usually straightforward. And they're also quite often associated with significant morbidity and mortality, okay? And again, to compound the problem, while they are genetic, but there are other modifiers of the disease. Some of them may be on genes that are not directly related to the gene causing the disease. And there are also several environmental factors that modify the disease. Therefore, the phenotype is quite variable quite often, okay? And that again compounds the understanding, especially in the lay public, of how these diseases present. The other big problem, of course, is that many of these diseases are prevalent in disadvantaged communities. Therefore, interventions and treatments are not readily available. So this complexity of problems and issues make it mandatory that there must be some bodies that advocate for these diseases, okay? And if we just look at the situation in the low and middle income countries for a minute, we know that the awareness may be lacking because knowledge of the disease may be poor. And that poverty of knowledge is not only limited to the general public, but even among healthcare workers, okay? And that's why we advocate that even in medical schools, the curriculums need to, address some of these issues so that the products of the medical schools or nursing schools and other healthcare workers are trained properly. Now, there's also tremendous stigma that is associated with many of these diseases. And the stigma comes at different levels within the culture, in the community, in the hospital, at school, and work. The sad part of it, in fact, is the stigma that these patients quite often face within the hospitals and with healthcare workers. It's very disheartening and leads to all kinds of frustrations and mental health issues. Okay. The other problem in low and middle income countries is that diagnosis is usually late or non-existent, and most patients live in rural areas with poor access to health care. Moreover, especially when you talk of things like sickle cell disease in Africa, the numbers of patients are overwhelming. And tied to that is the poor infrastructure, power, equipment, specialized facilities, and trained staff. So these are problems that need to be overcome in those societies. Now, who are the stakeholders that are important in the scheme of things? First of all, because of the complexity of the diseases or the disorders, the most important people or the starting point has to be with the health professionals who make the diagnosis, run the clinics, and have the wherewithal. And they also have their associations, within which they can start the whole process of advocacy. And then there are non-governmental organizations, NGOs, that are devoted to advocacy. But probably the most important advocates are the patients themselves, because they understand their disease. So they need to get organized, but they need help from the health professionals to get the organization going. So while such groups do not need to be run by health professionals,
Professor Adekile.
health professionals have to act as you need to also nurture them. You need to identify some people that you can train to understand the disease you are advocating for, so that they can put out truthful and relevant information in their media, whether the print, radio, television, and then of course social media is also quite important. And these days we have the so-called celebrities and influencers, and these people in many societies carry a lot of recognition and influence. And if you can acquire some of them to advocate for the disease, then that's quite helpful, especially if you find some of them who also live with the disease. However, at the end of the day, the people who can really make change, meaningful change in society, has to be government and policy makers, okay? And since the early 2000s, the WHO and the UN has advocated that in all societies with a high prevalence of these diseases, there should be a national policy, okay? And this national policy should support early diagnosis and the establishment of comprehensive clinics, genetic counseling, health insurance, because these are chronic diseases, lifelong diseases, and can be very expensive, to manage. So we need health insurance. Then there should be policy about education and awareness at all levels, in the schools and medical schools and colleges. We need to incorporate some of these, especially where there's very high prevalence, like in sickle cell disease in Africa. We need to introduce it in the curriculum as early as possible. And there should be advocacy at the workplace, so that they can give some concessions to some of these patients. You have to let your employers know the nature of the disease. You need to go to hospital or keep your appointments. You may need to have compensations for some of the things that you are doing. And then there are some governments that also have some program of handicap identity and compensation. Where those are available, we should tap into it and take advantage of it. Now, just to illustrate the importance of having a national policy. Many of us are aware of the situation in the US in terms of the longevity or survival of sickle cell disease. Now, up to the early 1970, the mortality of sickle cell disease was almost as bad as it is now in low and middle income countries, while the longevity or lifespan of other Americans has been increasing steadily. It was not until early 1970 that we had this very remarkable increase in the life span of patients living with sickle cell disease. And the trigger for this was the enactment of the national policy, the Act for the Management and Control of Sickle Cell Disease, that was signed into law in 1972 by President Nixon. That made funding available, and cooperative centers, sickle cell centers were established. Different studies were initiated. The first one was the penicillin prophylactic study that showed that just using penicillin prevented a lot of the mortality in early childhood. And I'll use this example of what happened in Nigeria with an NGO that was started by the first lady of the state in Katsina, in 2010, and they started looking, advocating for sickle cell patients, having awareness drives, and identifying patients, and very briskly, the numbers of patients grew to over 18,000 within 3 years, and they organized some community clinics where they had 1 or 2 doctors and nurses. But at each clinic, there would be like 200 to 300 patients. So they became completely overwhelmed. And to make matters worse, when the governor at that time lost the next election, there was no more funding available for the program, and it was scrapped. So all these patients were just thrown, to their own devices. Okay. And there's a lesson to learn from that. And I'll illustrate that in this next slide. That what are the practical issues when you want to advocate with policymakers and people in government? First of all, you yourself or your group have to be well organized. You need to be armed with facts about the disease so that you know exactly what you are talking about, okay? And what we used to do when we started the Sickle Cell Support Society in Nigeria was to target the executive, governors, and the president and their wives. And what happened in Katsina taught us a lesson that even when the current occupier of the government house is interested in the disease, if he loses the election and is thrown out of office, then his program or her program may die with him or her, okay? And that's why we now realize that it's probably better to walk through legislators rather than the executive. And it's a pity that the senator is not able to join us today. It would have given us more insight. Now, senators in legislators in many democracies do not have a term limit. So the chance that they will, once they win the elections, they can come and stay for a long time, and they make the laws, okay, with the executive signs. So you need to cultivate a relationship with some of the legislators. And these are politicians. The language they understand is elections and votes. So you approach them from that point of view. Let them know how many people in their constituency are affected, how it affects them, how they suffer, how it affects them economically. Okay, so you present all those facts, okay, and you get it, and you invite them to join you at some of your activities, and you interact with them on a long-term basis, okay? And that way, they may be able to champion your cause in the state assemblies, okay? Now, you also have to know that in many of these state assemblies, they have health committees, okay? So you have to know who are the members of those health committees and get to know them well, and then advocate, with them, with your list of, asks, as Riyad has mentioned. Then the next set of people that you really need to work with the ministries of health. In many places now, at least in Nigeria, especially with sickle cell disease, at the federal level, we have a desk officer in the Ministry of Health for sickle cell disease. And in many of the states, the same happens. So you need to, if you need to work with that kind of person wherever they exist, okay?
Excuse me, Dr. Adekile, we are just about out of time.
Okay,
So I just
this is
wanted to
my last
give you
slide.
that warning.
Thank you. This is my last slide.
Okay.
And when you are interacting with legislators or even doctors in the ministries of health, do not assume that they know about the disease. Okay, we went to one of the states in Nigeria. We were talking to the permanent secretary in the Ministry of Health about sickle cell disease, and he confessed that they were not aware of any state policies for sickle cell disease, and asked us that if we knew any policies that were available, any guidelines, we should please get them across to him. So don't assume that they know everything. Just present your case, and persistence. This is a marathon. You don't get results just overnight. So you have to keep at it and don't be discouraged. Okay. Now, my last point is this. In many places, we have multiplicity of advocacy groups, and they're all lobbying this for attention and funds from the same government simultaneously. So that can cause an overload. So it's better to get organized and unite so that you all talk with one voice. So thank you so much. I hope we can get time for discussion and we can cover some other points.
Thank you so much, Dr. Adekile. Your passion, Riyad's passion, is so evident, and so it was very hard to cut you off. So thank you so much. We only have a few minutes. We have about 10 minutes, right? So now would be the time to open up the floor for questions. And I'm just checking the
Just
chat.
before we go to questions,
Go ahead.
sorry, Josie, I just wanted to advise. I know some of the people on this call are from Nigeria. There are patient groups in Nigeria who are really hoping to have Senator Sunday Katung speak to the bill that he just introduced. So just to give people the information on that, the bill is Bill SB 893. First reading was done July 10, and second reading is done a few days ago. The bill is to establish research and therapy center in, I think, 6 geopolitical zones in Nigeria. And again, while Senator Katung was not able to be on this call, if there are specific questions around the bill, we'll be happy to take those back to him. But again, the bill is Bill SB 893. For those who wanted to note that bill down. And he has sent his apologies that there is an assignment that he was called to do urgently that he could not do, and that's why he was not able to be with us today. Just wanted to make sure that people are aware that he wanted to be here, but it was just as government responsibilities go sometimes. And this is why he was called away. With that, I'll take it back to Josie, and we can take a few questions before the closing remarks. Thank you.
Well, thank you, Lanry. I've been monitoring the chat, and there seems to be a lot of enthusiasm to receive your slides. So it is a lot of information, and again, your years of dedicated advocacy and what you have learned really spoke to me, and I think it spoke volumes to many others in the who are participating. We are up to 68 participants, and so there are no other questions. We really did receive just overwhelming requests for your slides. And there was a comment that someone has started a petition for affordable sickle cell drugs in Nigeria and in Canada. So I will ask hopefully we have enough time for this. So now Riyad and Dr. Adekile, you both endorse the idea of collaborating and coming together as many. Now, do you think GANSID membership is enough to I guess to have meaningful advocacy in different countries, like the membership that is here? I mean, we know we have folks who organizations that are dedicated to sickle cell disease, some are dedicated to thalassemia, others might be hemophilia or some other rare disorders. So do you think the GANSID membership could actually be effective in advocating in certain areas, in certain parts of the different countries?
If I may go first, yes, definitely. And I think GANSID itself can provide support. We're not going to do the work for them, but we provide support and we learn from, shared experiences. And I think there's enough expertise within the membership and within the board of GANSID and all other resources that we can help these groups get together. I'm gonna let Dr. Adekile provide his point, but I also want to raise something that is worth discussion. And I'm glad that Dr. Adekile mentioned that there are multiple organizations sometimes competing for the same funds or competing for the same issues, which very often becomes counterproductive. And it's important to discuss how we're gonna work with that and improve on that so that it becomes one collective voice within the one disease groups or something like that, that.
Yeah. Sure, thank you. If I may go now. GANSID is so well placed and it's already playing a big role, in advocating with governments in different countries. And well, hopefully, the CEO may also be able to chip in on this. Now, both her and myself, we've visited some countries. We've been on different webinars with so many other countries. And it's been an eye-opener, I mean, especially when we went to Sierra Leone, they lack so many things. They don't have professionals. They had only one hematologist in the whole country who was no longer even practicing. Okay, all the health budget is donor driven. So we were able to provide some, kind of insight into how things can be organized, right? And in many places too, we share, guidelines from other places. However, when it comes to organizing the different advocacy groups within the countries, I think the lead has to be within the countries. So it's kind of difficult for GANSID to come in and try to organize and advocate individually with governments in those countries. And that's why, especially in Nigeria, with the multiple, different advocacy groups for sickle cell disease, we're asking that they should form a coalition, so that when they want to advocate with government, they talk as a coalition as much as possible. And again, Nigeria is so big, so maybe they may have one for the geographic north and one for the geographic south, or the different geopolitical zones. But those things need to be figured out. I don't know if we can accommodate language.
I would like to actually, and I apologize to Sunmi Sola, who put the question in the chat and I missed it. So I want, and it dovetails nicely into the example in Nigeria because this person wrote that they've started a petition for affordable sickle cell drugs in Nigeria and Canada. Has shared videos and collected survey responses from patients who say the drugs are too expensive. So the question is, how can this person take their advocacy to the next level and make more impact? And then they wrote, I know I can't make the change, but what steps can I take?
If I may jump in quickly to help answer that question. So Simisola, I'm not sure if you live in Nigeria or if you live in Canada. But if you do live in Canada or have some ties or some work you're doing in Canada, I will advise that you connect with me and I can work with you. I can tell you that we are already, so one of the most important drugs, because it seems like you're in the sickle cell space, is hydroxyurea. We are currently advocating with the Ministry of Health to cover the drug of hydroxyurea. As you know, in Canada, health is provincial in the province of Ontario. And we are also working with Health Canada to ensure that, hydroxyurea is also indicated for sickle cell care. So you can definitely, be part of what we already started, because work is already being done and going on in this area. In the terms of other treatment options, such as gene therapy, that again is something that's been advocated to be covered by the government. So just to buttress the point, some of this work has been done and we don't want to reinvent the wheel. We just want to work together. So if you connect, I'll be happy to, provide you with updates where things are and how, we can all work together. Thank you. To
Do we
share.
have more slides?
Yes, we do.
Landry,
So
thank you. Okay,
yes,
my
sorry about that.
apologies. Yeah, no
So we do
problem.
have a few more slides. So before we actually close, we wanted to buttress the point again that the month of October is World Inherited Blood Disorders Month. For the whole of this month, we are asking you to do something to raise awareness. It can be to meet with your, a member of parliament or a member of provincial parliament, whatever it is. When you go, tie red, ask them to also tie red. Take pictures, share on social media is very important. It shows that we are standing together in solidarity to support, those who are affected by inherited, blood disorders. Next slide. I also want to advise that we also have our third International Congress on sickle cell and other inherited blood disorders coming fast, November 14 and 15. We ask you to please mark this date, and there's still room to register. Registration closes October 30, so you still have, about 2 weeks to register if you've registered, and share with your clinicians in the hospital, share with, patient organizations. It's for all of us to be part of this and to learn together, as a team. And last, I just wanted to thank everyone again for being part of, today's session. This is a first, World Inherited Blood Disorders webinar that we are doing. And I hope that everyone benefited and everyone will take one or two things from what has been discussed today to advance. Number one, getting World Inherited Blood Disorders Day enacted in your own jurisdiction. We are working together in Canada. We are hoping that more countries will take suit and they will follow the same way and they will get it done in their country. We are also hoping that you will work together more collaboratively. To Dr. Adekile's point, the more we come together, the better we can advance advocacy. And if we are splintered and fragmented, it's not going to help the cause. So thank you so much for being here. And I'm also hoping that, we will hear more from everyone, as we continue to celebrate this month on what you've done and how you have celebrated your World Inherited Blood Disorders Day or month. And on this note, I'll pass it back to Josie. Thank you.
Okay. Well, everybody, thank you for hanging on until the end. We did go a couple of minutes over time, but only a couple of minutes. It is unfortunate that we missed the senator today. And for those of you who have requested slides, I think the membership or the participation list has been noted, and maybe Landry or Daniela can comment on that. But what I will do is a hearty thank you also to our Riyad Elbard and Dr. Adekile for imparting us with your wisdom and your experience. We appreciate it very much. Everyone have an excellent day, and thank World Inherited Disorders Day in 2 days. Bye-bye.